Hello, Anna Napoli from the Finance News Network, and joining me now from First Group is CEO and co-founder Klaus Bartosch. Klaus, welcome to FNN.
Yeah, hi Anna, how are you?
Good, thank you. First up, can you tell our audience a little bit about First Group?
Yeah, look, the problem we're solving as a company is a very simple one, which is that everything that we do as consumers, as patients with healthcare is hard. Accessing them is hard, booking appointments with them is hard, interacting with them is difficult, and it's because, here we are, it's the age of the internet, and we're still required to pick up the telephone to book an appointment during business hours to get access to these vital services. So our company's job and our platforms are all about simplifying more of what we do as patients, as consumers, by moving more of that online, and it starts with booking an appointment online. And being able to do that at the convenience 24 hours a day, 7 days a week, in the same way we do everything else we do online.
Now, Klaus, before we talk about your different portals, can you tell us exactly what it is you're trying to achieve?
Today, there are some 47 million appointments being booked over the telephone every single month in just Australia and in just private practice. So our job, our goal is to shift the bulk of those to enable us to interact online. So, we have a broad range of healthcare services that we support today, over 6,000 businesses now nationally. And our key objective is to bring as many of those healthcare companies onto our platform as we can. While over 6,000 sounds like a big number, there are over 150,000 businesses in Australia that we can and could service.
Now, could you tell us about your portfolio, starting with myhealthfirst.com.au?
Myhealthfirst.com.au is a platform that now services over 6,000 Australian healthcare businesses across the country. And what we do is we make it simple for patients to go to the portal when they're finding and looking for new services for the first time, or if they happen to be on a practice's website, they can also book through the practice's website through one of our website widgets that allows them to launch the booking function to book an appointment. But booking an appointment is only one part of what the My Health First platform does. It also simplifies you when you arrive at a practice. No need to arrive at the reception desk to check in. You walk up to a check-in kiosk and check in with your Medicare card, as an example. And when you've had your consult with your doctor or dentist, post your consult, you get invited to provide feedback on not only your experience with that doctor and the practice, but did you understand what it was that was being told to you? And it gives the practice an opportunity to re-engage that patient who might have left that consult perhaps a little confused about the kind of services or the kind of things that might have been shared with them.
Fantastic. And what about petyeti.com.au?
Yeah, so Pet Yeti is the platform to look after the other family members that many of us have, the fluffy ones. And so not only can you look after the health of your children, but you can also look after the health of your pets. So through Pet Yeti, you're able to book veterinary services and grooming services. And so two of our major clients on Pet Yeti, for example, are Green Cross and Pet Barn. And so it's again about simply making the things we do easier.
And what about gobookings.com.au?
So Go Bookings is a rich underlying appointment booking function, and it services the broader healthcare marketplace that we provide. So think of it as the underlying software as a service technology that My Health First and Pet Yeti exploit.
Can you give us a snapshot of your financials, including the split between recurring and transactional revenue?
We have 4 sources of revenue: subscription fees, setup fees, usage fees, and advertising fees. Subscription fees, which is our monthly recurring revenue subscription fees, has been the mainstay of the company for many years when we first started and launched the company. And what we've been doing over the last 2 years in particular is adding advertising revenue and usage fees as additional new revenue lines and new products to our network and to our platform itself.
And Klaus, can you tell us about your company's strategy and how you're progressing?
So we've, over the last 2 years, have executed some quite specific strategies to grow and scale and improve our business model across new markets. In particular, we've grown from 10% to over 65% now of all Australian pharmacies in Australia that now use our technology. We've now got over 60% of optometrists, independent optometrists on our platform, and a growing large market of veterinary services and pet services.
Last question, Klaus. Why should investors consider adding First Group to their portfolio?
When investors think about our company, they need to understand the long-term nature of what we're building and the sheer size and scale of the opportunity. Even in just Australia alone, we're operating in a $1.9 billion market based on our current fee structures and current known product opportunities. My kind of background and my history was surrounded with people from companies like realestate.com.au, car sales and Seek. And so when I think about where are we going as a company, well, long term, it's about trying to build that kind of organisation, that kind of business in a marketplace that is frankly larger than all those other online companies combined.
Klaus Bartosch, thank you for the update.
Thanks, Anna. I really appreciate it.